Hello, today we are with my dear patient Samantha. I performed double jaw surgery and genioplasty, so it's been 2 months that I have performed surgery, and today we prepared Invisalign trays. She's with Invisalign now, so she will have Invisalign treatment also. She looks very good, I guess. Samantha, could you please briefly explain about your journey and introduce yourself? How was the double jaw surgery? How was the post-operatively the surgery healing process? And would you recommend this surgery to the patient who needs double jaw orthognathic surgery?
I can start with the recommendation, and that is absolutely 100% I would do it again. And that's because just for like reference, I went seeking this surgery because I suffer from obstructive sleep apnea. So what I found was that I was not getting the quality of sleep that I needed. And I've always kind of like had that throughout my journey. So what was the most important thing for me was for me to find the right place to do it. I didn't want to do it on the cheap. I wanted to do it with someone in the right place where I knew that I was going to be taken care of. It took me, I think it took me about 4 or 5 months finding the right place. I was going to lots of different clinics and kind of asking questions before I actually moved forward with it. So I did actually expect it to take a lot longer for the swelling to go down, but thankfully I feel like I can actually talk properly. I do know that the orthodontic side of it's going to take a bit of time, but that's absolutely fine, because from literally day one of waking up in the surgery, I could literally feel myself breathe. And I know that doesn't make a lot of sense, but when I'm walking and talking, I'm absolutely fine. But when I go to sleep, my neck would go back a little bit, and I could feel like there was a little bit of a struggle. And I imagine that was a lot worse when I was actually asleep. So since the surgery, I've been able to, actually sleep.
Great.
And wake up and feel like I've slept. Because I used to sleep 12 hours, 13 hours sometimes.
In the past, you mean?
In the past, and now I can have 8 hours and it feels like I've slept.
That's great. Yes,
Yeah.
that's great. And what about the hospital that we did the operation? How was it?
I was actually quite impressed with the hospital, to be fair. I feel like the staff were really attentive. I felt like I was being looked after. Yeah, it was just a very comfortable experience for major surgery.
Okay, thank you very much for explaining about your journey and about your treatment. Okay, we are very happy. I'm very happy with your result, really, because we did a lot of movements for you had cluster abnormality, so we did big movements, and the result is quite stable for you now, and we passed the critical time for the surgery, so everything is now stable. So by the time it will improve, and after Invisalign treatment, everything will be better and better. So even for now, everything is quite stable, quite good. I'm very happy for the results. So when my patients come for checking up, I'm very excited because I want to see a good result. So to see you again, it made me very happy. Thank you.
Thank you very much.